Hello juniors, so I welcome you all again in the continued series of lower limb, and today we are going to cover an easy yet an important topic, which is the structures under the cover of gluteus maximus. So giving you an outline of the today's topic, we will be covering the structures which are present underneath your buttock muscle, the major muscle of your buttock, which is the gluteus maximus. We will be covering structures under this gluteus maximus. So we in today's topic we will be covering its muscles, vessels, nerves, bones and joints, and finally we will be covering the clinical relevance. Our today's topic is a bit volatile topic. You have to revise it many a times, and in today's mod and today's video will be full of images, depictions to make you the visualize the topic more easily, and in between I also give you the mnemonics to remember this topic. So without wasting any further time, let's move ahead. Starting with the muscles underneath the gluteus maximus. So your gluteus maximus is the large buttock muscle. This majorly constitutes your buttock. So if I dissect out this gluteus maximus, if I dissect out this gluteus maximus, what I'll able to find is the muscles beneath this muscle. So this is the figure that help you visualize this. So this, when I if here was my gluteus maximus muscle, and if I dissect out this muscle, I'll be left with the muscles shown here. So the muscle marked with the 2 is our gluteus medius muscle. This is the gluteus medius muscle, and if I cut it out, and beneath the gluteus medius I get is what the gluteus minimus muscle. So at the topmost, at the most outer side, I have gluteus maximus muscle. Beneath gluteus maximus I have gluteus medius, and if I again cut the gluteus medius, I am left with the gluteus minimus muscle. The next muscle which we able to see is this muscle numbered as 8. This is the piriformis muscle. This is the piriformis muscle. Beneath the piriformis muscle are the two set of muscle. This is 7 and 5. As you can appreciate, these are both slender like muscles. They are almost equal shape and size. These two muscles are gemelli muscles. These two muscles are gemelli muscle. The upper one is superior gemelli and the lower one is inferior gemelli muscle. Between both the gemelli muscle is our obturator internus muscle. This is the obturator internus muscle which is in between both the gemelli muscle. And the muscle regarded as fourth is our quadratus femoris muscle. So this is our quadratus femoris muscle. Obturator externus muscle is just beneath the quadratus femoris muscle. I'll show you this better in my 3D anatomy app. For now, we come to hamstring muscle and adductor magnus muscle. So these muscles arise from ischial tuberosity. So this is our ischial tuberosity, and this ischial tuberosity was covered by gluteus maximus muscle initially. If I dissected out the gluteus maximus, I am open with the ischial tuberosity, and the muscles arise from ischial tuberosity are hamstring muscles and adductor magnus muscle. So this is our group of hamstring muscle which constitute semimembranous, semitendinosus and bicep femoris muscle. For now, adductor magnus, and once again all the muscle I'll review on my 3D anatomy app. So reviewing all the muscles on this 3D anatomy app. So the outermost muscle, this is the posterior view, this is the coccyx, this is the sacrum bone. So the outermost muscle, which is this gluteus maximus muscle, If this I cut out and reflect the head of the gluteus maximus, what I am able to see is the group of muscles I am showing you here. So this is the gluteus maximus muscle, and if I dissected it out, what I am left with, this is our gluteus medius muscle, as I've already told you. This is my gluteus minimus muscle. This is our piriformis muscle. One, I will keep on dissecting them. This is our gluteus medius dissected out, gluteus minimus dissected out, piriformis dissected out, and these are two gemelli muscle, as I have already told you. These are two gemelli muscle. This is superior gemelli, this is inferior gemelli dissected out, and this is our obturator internus muscle. Now what I am left with is this muscle. Oh, this is our gemellus inferior muscle, and this is our quadratus femoris muscle. So as I've already told you in my module, this is quadratus femoris, and just beneath the quadratus femoris is our obturator externus muscle. This is our obturator externus muscle. This. So the name obturator muscle arrived from this obturator foramen. This is our hip bone, and this foramen is our obturator foramen. So the muscle which covers the obturator foramen from inside is the obturator internus, and the muscle which covers the obturator foramen from outside is the obturator externus. This is our ischial tuberosity. This part of the bone is our ischial tuberosity. You must be able to appreciate this. And from ischial tuberosity arise our hamstring muscle and adductor magnus muscle. So this is the semitendinosus muscle. This is our long head of bicep femoris. This is semimembranous muscle. And last one we are left with is this adductor magnus muscle. So once again, reviewing all the muscles, this is our gluteus maximus muscle. If I dissect out, I am left with gluteus medius, gluteus minimus, piriformis, two gemelli muscles, superior and inferior gemelli, obturator internus, quadratus femoris, and I have already told you the obturator externus muscle in my 3D anatomy app. The adductor magnus I have already shown you, and hamstring. These are the hamstring muscles. Now I have a very good mnemonic for you, and the way I used to remember this, the muscles beneath the gluteus maximus, is by a special mnemonic. Only Indians will understand this mnemonic. So she is a famous Bollywood actress, and she is Priyanka Chopra. And those who don't know, Priyanka Chopra is married to Nick Jonas, an American singer and actor, and he is a famous Bollywood actor, the Amitabh Bachchan, and the mnemonic is somewhere in the multiverse, Priyanka Chopra is married to Amitabh Bachchan. Priyanka Chopra is married to Amitabh Bachchan. So many of the people are able to remember the gluteus medius muscle and gluteus minimus muscle beneath the gluteus maximus muscle. So our mnemonic will not include these two muscles, rather our mnemonic will include rest of the muscles, which will be the mnemonic will be Priyanka only questions of his Amitabh. So here the Priyanka will stand for piriformis, only for obturator internus along with two gemelli muscle. Questions is quadratus femoris, Of the word of will stand for obturator externus. His is for hamstring muscle, and Amitabh will for adductor magnus muscle. So here is a image where she is searching for Amitabh Bachchan. This is a bit sarcastic image because Amitabh Bachchan is 6'2" and she is viewing with a magnifying glass. But for your sake of simplicity, for your better remembering, so Priyanka is searching and Priyanka is questioning to everyone. Priyanka only questions of his Amitabh. Then with the muscles beneath the gluteus maximus, now coming to the vessels beneath the gluteus maximus. So this was our gluteus maximus muscle, and we have cut it out so we would be better able to visualize the vessels under the muscle. So basically there are four major vessels under the gluteus maximus and two anastomoses. So what are the anastomoses? Anastomoses are the connection in between the vessels. So the major vessels under the gluteus maximus muscle are superior gluteal vessels. So these are the superior gluteal vessels marked with 3 number. So these are superior gluteal vessels. They supply the gluteus muscle and various other muscles lying in this region. The name superior arrived in relation to the piriformis muscle. This is the piriformis muscle. The vessels above the piriformis will constitute the as superior gluteal vessels, and the vessels below the piriformis will constitute as inferior gluteal vessels. So these are inferior gluteal vessels. Nextly, the internal pudendal artery. So the word pudendal in Latin means something to be ashamed of. So internal pudendal artery supplies to our anal opening glory hole. So this is our internal pudendal artery. I'll show you this in a next depiction. And the medial circumflex femoral artery. Medial circumflex femoral artery I have covered in great detail in my hip joint video. So for now, this is the image taken from BDC. You will be better able to visualize all these vessels. So this is our gluteus maximus muscle. This is gluteus maximus, and we have reflected out the dissected gluteus maximus, so you would be able to see the vessels under it. So this is our superior gluteal artery and its related nerve. So this is the superior gluteal artery coming above the piriformis muscle. This is our piriformis muscle, therefore named as superior gluteal artery. Inferior gluteal artery is coming from beneath the piriformis muscle. This is coming from inferior to the piriformis muscle, therefore named as inferior gluteal artery, and it is accompanied with its nerve. Nextly, the internal pudendal vessel. This is the internal pudendal artery and veins which goes and supply to the our anal opening, and this is accompanied with pudendal nerve. And the medial circumflex artery is shown in this diagram. This is our medial circumflex femoral artery. And lastly, the two anastomoses. So the two anastomoses are trochanteric anastomosis and cruciate anastomosis. So these are the two important anastomosis. This is our trochanteric anastomosis, which is formed by the branch of superior gluteal, branch of inferior gluteal artery. These both arteries are in the blood supply of hip joint, and from lateral circumflex femoral artery and from inferior gluteal artery. Similarly, the cruciate anastomosis is formed by the lateral circumflex femoral artery, ascending branch of first perforating artery, and transverse branch of medial circumflex femoral artery. All you have to remember is the name, which are trochanteric anastomosis and cruciate anastomosis. So the basic vessels, the major vessels which are Lying beneath the gluteus maximus muscle is superior gluteal vessels, inferior gluteal vessels, internal pudendal artery, two anastomoses which are trochanteric and cruciate anastomoses, and medial circumflex femoral artery. So the mnemonic to remember this is something like that. Mnemonic will be, so our previous mnemonic was Priyanka was searching. Priyanka only questions of his Amitabh. This was our previous mnemonic. Continuing with the searching of the Priyanka to for his Amitabh. Now, Priyanka is married to Nick Jonas. Now she is in America, but she's still searching Amitabh. So in now it is winter season in America. She is in Chicago, and there's a lot of mist in winter season of Chicago. So Priyanka keeps on searching for his Amitabh, even in the mist in Chicago. So medial circumflex femoral artery, M, internal pudendal artery, superior gluteal vessel, and T for trochanteric anastomosis. In, and for N, I here is for inferior gluteal vessel. Chicago is for cruciate anastomosis. So done with the vessels beneath the gluteus maximus. Now coming to the nerves beneath the gluteus maximus. So similarly to the vessels, nerve also accompany them. So our superior gluteal nerve, which accompany the superior gluteal vessels, similarly it is also superior to the piriformis muscle. Inferior gluteal nerve, this is our inferior gluteal nerve. It is beneath the, it is below the piriformis. Our sciatic nerve is the major nerve right here. This is the sciatic nerve. Our posterior cutaneous nerve of thigh, this is our posterior cutaneous nerve of thigh. This brings the sensory information from posterior aspect of the thigh. Pudendal nerve, as I have already told you, the word pudendal came from Latin to mean, which means something to be ashamed of. So this pudendal nerve goes to the anal opening, and nerve to obturator externus. This is our nerve to obturator externus, similar to the vessels of obturator externus. So if you are able to remember the vessels beneath the gluteus maximus muscle, you will be surely able to also remember the nerves beneath the gluteus maximus muscle. So the bones and joints, coming to the bones and joints beneath the gluteus maximus, it includes the ilium bone, ischial tuberosity, upper end of femur with greater trochanter. So this is our ilium bone. This is our ischial tuberosity, and this is the upper end of femur with a greater trochanter. So basically our gluteus maximus was like this. This was the path of gluteus maximus muscle, origin and insertion. And if I remove the gluteus maximus muscle, what I am left with the ilium bone right here, the ischial tuberosity, and the greater trochanter of the femur bone. These are the underlying structures which are lying beneath the gluteus maximus muscle. So up till now, if you are with me, you must be wondering, is sir beaten by a mad dog or is sir gone nuts? Why he is wasting his 20 minutes and our 20 minutes as well? Because there is an important tie-up between the structures beneath the gluteus maximus muscle and day-to-day clinics. So starting with the clinical relevance of gluteus maximus and structures beneath it. So starting with the intramuscular injection. So intramuscular injection in gluteal region is one of the commonest site of intramuscular injection of the drugs. So you will encounter this when you will go in your clinical rotations. There you will be asked to injection in the gluteal region. Now if you are a quack or if you don't have much experience, you will see the buttocks and anywhere you will injection, but that could be disastrous for the patient and he will definitely sue you. So what is the reason behind the intramuscular injection is the sciatic nerve, which is an important sensory and motor nerve. If that nerves get damaged while giving an intramuscular injection, that could be disastrous to the patient. So always remembering where to give the intramuscular injection at buttocks region is very important. So for clinical point of view, your this is your buttock and it is basically divided into four quadrants. So the outer and upper quadrant is considered safe for giving intramuscular injections. I'll show you this in a minute. Nextly, the sciatic nerve block. So sciatic nerve is blocked by injecting an anesthetic agent. So whenever you will go in your clinical rotations of surgery, you will see while operating the lower limb, the, the anesthesiologist will inject an anesthetic drug in the sciatic nerve. So this nerve, which carry the sensory and motor fibers from lower limb, will be blocked and will be helpful in operating procedures. Nextly, coming to the piriformis syndrome. So piriformis syndrome is a clinical condition characterized by pain in buttocks due to compression of the sciatic nerve by the piriformis muscle. So showing you the picture of this in a minute. So this is the piriformis muscle. So this syndrome commonly occurs in sports that requires excessive use of this muscle. Excessive use of the piriformis muscle lead to hypertrophy of this muscle and causing the compression of sciatic nerve, and this causes a shooting or radiating pain in the buttocks and till the extension of sciatic nerve. So I was telling you the intramuscular injection. So now up till now my few juniors would be wondering, sir, is she your girlfriend? The picture of yours and hers in Goa, very cute, very sexy. So no, not at all. You can imagine anything, I will also imagine. So telling you about the intramuscular injection, don't focus anywhere else. So this is our buttock, and if we divide it into four quadrants, so this quadrant is safe for giving intramuscular injection. Right here, this is safe for giving intramuscular injection. And another way to give intramuscular injection is to palpate the PSIS, which is posterior superior iliac spine. Posterior superior iliac spine is somewhere right here. When you palpate it or when you feel it, and from posterior superior iliac spine to the greater trochanter of femur, right here, somewhere right here, the greater trochanter of femur bone, and if you sketch a line in between them, so the region above this line is safe for giving the intramuscular injection. So at the end, completed with the muscles, vessels, nerves, bones and joints, and lastly the clinical relevance of the structure under cover of gluteus maximus muscle. So if you found this video helpful, if you found this video useful, do like it, do share it with your friends. Thank you.